Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Well, happy Halloween. Thanks for tuning in here on this Monday morning. I'm Ryan Kalei Suji, joined by Yanji Denise, and this is Spotlight Hawaii, live on the digital platforms of the Honolulu Star-Advertiser's website and Facebook page. This morning, we focus in on a topic that could be something that we see come to reality in the next legislative session.
That's right. The state has been talking for years about the possibility of legalizing marijuana for recreational use. Of course, Hawaii now does have medical marijuana authorized for medical use, but could we see that expanded further out? The state is holding a series of meetings, and joining us now to talk about what's happening with those meetings and where some of these initiatives could be going is State Representative Ryan Yamane, along with Hawaii Cannabis Industry Association Chairman Cheng. Cheng also is the president of Aloha Green Apothecary, which is one of the medical marijuana dispensaries in the state. Gentlemen, thank you for being here.
Thank you. Thank you
for having us.
So, Representative Yamane, let's start with you. Tell us about the meetings that you've had thus far and what those conversations have been like.
So for years, we've been hearing reports about, the potential windfall and the impacts of doing legalizing of marijuana use in the state of Hawaii. So the legislature put together a task force that involved a number of stakeholders to come in and have these discussions coordinated through Department of Health to get as much information as we can so that in the future, as lawmakers make decisions, that they have the most accurate input from the community as well as stakeholders. And so we are halfway through. We'll have another meeting later on today as we move through our priorities. And we really are thankful for all our colleagues, stakeholders, those in industry, experts throughout the country that provided input as we move forward.
And Rep. Yamane, I just want to stay with you here for a little bit. What is the difference moving forward into this next legislative session? Because we know that this is nothing new, that this has come about and has been proposed in the past. But what do you think is the biggest difference this time around with these meetings that are being held as we head into the next legislative session?
So there's a lot of my colleagues and in the legislature that want to move towards legalizing. It's in 19 other states in the country. And there's a discussion of that if Hawaii eventually moves to that direction, how does the system work? Does that replace the medical marijuana system? Does it work together? And so what we actually have is a lot of people who are interested in moving forward, but the common factor underlying foundation is they want to make sure it's safe and it matches our unique cultural aspects of Hawaii. And so doing this, we got a lot of support from those that wanted to provide input, provide stats. We met with not only providers, but surveyed users. We both worked with law enforcement as well as Department of Health. And so what we're trying to do is make a concerted, open, transparent process to get as much information as possible.
Okay, Ty, let's bring you into the conversation now. We want to get your perspective. First, of course, as the industry association chairman, what's your organization's stance on where this should go? And I think there's this perception that you can just flip a switch and legalize it, and everyone, that's that. But this is a pretty complex process. Tell us about sort of where you stand. Also, bringing in your perspective as one of the medical dispensaries.
No, thank you for having me. It's the organization itself is called the Hawaii Industry Cannabis Association, and it represents the 8 medical licensees that currently provide medical cannabis here in the state of Hawaii. Our position has been to support legalization of cannabis for adult use. For the first 5 years of the program, of course, we've been focused on trying to stand up the best medical cannabis program possible by providing affordable medicine and a variety of medicine to our patients. helping them so that they don't have to grow either cannabis on their own or rely on the illicit or gray market to supply their cannabis. I think the dual use task force is a great idea. It's done a lot of very good work. There's been so much input from the community and from the number of stakeholders. If you just take a look at the written testimony and oral testimony that's been provided, you can see that this is a very important topic and a topic that resonates with a number of the members in our community. And so I think it's very important that we do this right and that we build the program so that it meets the goals of the community. And one thing that we do agree on is that the medical dispensary program has worked hard over the past 5 years to open as many retail sites as it's able to, as well as reach economies of scale where they're able to provide lower cost medicine to patients. And so if that program isn't broken, we think that it's a great idea to build on top of the successes the Department of Health has already gained through the medical program, and that hopefully an adult use program can be layered on top of the current system.
And so just to follow up, if this is something that were to go through, what would happen to those medical dispensaries for those patients that are seeking this treatment through cannabis? Would they still need to go through the current process, or because it's going to be legalized, what would happen to that process that the people who currently utilize this are currently under?
And so that's a great question. The dual use task force is tasked with taking a look at how we would transition from one program to the next and whether or not we would build the adult use program on top of the medical program. If we look to other states on the mainland, it is a common timeline to see home grow to begin, the authorization of medical cannabis, the decriminalization of small amounts of cannabis, and then the opening of medical dispensaries or businesses that are able to grow and sell cannabis and that only to medical patients. And then further on the line, you see states move on so that anyone over the age of 21 can purchase and consume cannabis. The important thing here, though, is when there is that transition between adult use from medical, to adult use, that we make sure that the medical patients are protected and that there is enough cannabis medicine at that time to supply and to provide for patients. The use pattern of a medical patient is very different from a person who's just seeking the therapeutic and relaxation benefits of cannabis. A medical patient is going through, most of the time, pain, some type of symptom relief associated with chronic health conditions. And so they use and consume much higher rates of cannabis as well as dosing of cannabis as well. And so we want to make sure we don't lose those type of products for those type of patients and just focus on adult use products for people who are just consuming on an infrequent basis, once in a while, maybe in a social setting or just maybe at home to get a good night's rest.
And Representative Yamane, so much of this conversation, at least on the political level, has focused on the money and the potential tax revenue. What are you seeing in those terms right now? How much money is the medical marijuana industry thus far bringing into the state in terms of tax revenue? And what are some of the projections of what the state could gain if we legalized it fully?
So, one of the processes was trying to get accurate information. And so I just got today Department of Taxation's collections for last year from the period of July 1st, 2021 to June 30th of 2022. And so for that 1 year collections of the existing program was about $2.5 million. And some of that is primarily because of the testing fees for testing of the substances, as well as for the annual renewals. The Department of Taxation has reported estimates, and I know the industry has higher numbers, is that they're estimating from looking at other states is about a $200 to a $273 million annual collections gross sales for if we legalize marijuana in the state of Hawaii. So that would estimate maybe around $50 million of actual state tax collections, with the system that we have in place. And so, if you look at some of the impacts and issues that we would need to put in place for legalizing, that there's not much that $50 million can pay for, right? If you start let's say a new department or a new attached agency, that is minimum $8 million annually. And then there's going to be other resources that need to go to existing departments, like let's say Department of Health, um, Department of Taxation, and others, to be able to assist with any type of monitoring and collections to address the legal versus the illegal markets. And so there is not, at least from what's being reported from the tax collections and estimates, is that there's not this huge windfall that will be able to subsidize education or health services.
Ty, I want to follow up on the question. We just heard the numbers that Rep. Yamane reported, and he also mentioned that the industry has different projections. What are you hearing and seeing and thinking when you hear these numbers that the Department of Taxation is predicting and projecting moving forward with this? And how is the industry numbers different from that?
Well, I'll let
Thank
Ty
you.
talk about that. But okay.
Yeah.
Well, just for comparison's sake, in 2020, Department of Tax reported that they collected about $51 million on liquor taxes and liquor license sales. And so even on the low number side, we're looking at a tax revenue equal to about the amount of liquor that is consumed in the state of Hawaii. The industry itself has higher estimates. We estimate the actual adult use market to be around 400 million. We actually estimate the current medical market to be around 250 to 270 million. The reason for that is when an adult use market does open up, it's not only just people who consume cannabis who move from the illicit or gray market over into a legalized dispensary, but people who are curious about the use or who might feel that it could help with other symptoms that they've already are being treated with sleeping pills or with painkillers such as opioids. They might choose to switch off from that type of medication over into cannabis. And because it's adult use, they don't need to go through the difficulties of getting a qualification from their current physician. And so with our numbers, if we think about 400 million with a 20% tax, we would see about $80 million coming into the state. And this is without understanding how much tourists and visitors to the islands would consume if they came into the program. And one thing that DOE tax doesn't consider, of course, is that they're only considering the cash that's coming in from taxing, but the social benefit and the social harms that have already been laid upon a number of people who have been involved in cannabis, that goes away as well. So unnecessary prosecutions, wasting time and resources in our jail system as well as in our court system over small possession, those will go away as well. So there's other benefits that help, and at the end of the day, any state that chooses to legalize cannabis is looking at harm reduction and on its balance, trying to benefit the overall community versus the harms that is produced from a war on drugs.
Sticking with that legal question, Ty, I hope you can answer this question from one of our viewers this morning saying, is marijuana still a Schedule I drug? If so, how can it be legalized? There is this, disconnect between the federal categorization and what the state is potentially looking at. How have other states threaded that needle?
Yeah, so that's true. So here in Hawaii, actually, it is a Schedule I substance at the state level, and as well at the federal level, of course, it is on the list of Schedule I, which means that this substance has no medicinal value whatsoever and has a high likelihood of abuse. This is, of course, steeped in history on why cannabis was placed in that Schedule I, even though they knew there were uses for it in hemp fibers as well as in medicinal practices for Aboriginal peoples. But that aside, what other states have done is they've relied on this document called the Cole Memorandum, which was set up by the Attorney General under, at the time, I can't remember if it was Obama or if it was President Bush, but the Cole Memorandum states that the states are allowed to have control over their laws within their boundaries. And if they choose to do so and stand up a medical or adult use program, then that there are 8 principles that they must follow. And a number of those principles, revolve around making sure that there's no access to children, that there's no guns and violence that are involved with that there is a strong regulation and some type of oversight that the state will provide to these types of programs. And so through those type of, through the Cole Memorandum, as well as amendments that have been provided by Congress, which state that federal funds would not be used to prosecute or to investigate any state sanctioned, state legal cannabis program, then that is the protection that the states have used to allow for adult use. And like Rep. Yamane has spoken, 19 states have already legalized cannabis. In fact, Delaware and Hawaii are the only two democratically controlled states in the entire nation that don't have adult use cannabis.
So I would like to add
Sure.
to that question, since Hawaii is unique compared to other states where everything needs to be either flown in or shipped in, which fall under federal regulations coming in. So there are additional regulations that the state of Hawaii does keenly follow, as well as that unlike other states that can bring it over by vehicles or trucking, we do not have those type of resources. And so we in the state are very careful about making sure that we follow several federal FAA and other federal rules in order to not to put our federal matching funds, both for roads and construction, airports, and health and human services programs at risk. So we do have that caveat that I think is a little bit different than some of the other states, as mentioned.
Representative Yamane, you mentioned that we would possibly have to stand up a whole new department. What have those processes, can you tell us sort of on the, regulation side, would this fall under the Department of Health? Would there be a new entity that would do this? What is the state looking at in that regard?
So great question. So that's part of why we're doing this dual task force, because there's a lot of the states have wide variety of models. Some is under an existing department. Others, they made a whole new department. Others, it's an attached entity with stakeholders as part of the system. And that's what lawmakers will need to address moving forward. Whenever we look at, let's say we go through this process, one of the things that we need to be aware of is that it's not just allowing this type of substance in and use and a forgiveness of those that were arrested or put in prison for small use. There's going to be a huge impact not only on our legal system on addressing that and fixing any kind of overlay, but also moving forward, a lot of our businesses will be impacted. How is it going to be treated? Is it going to be treated like smoking, vaping, and alcohol? Or is it going to be treated as a medicinal personal choice? How are condominiums going to deal with that as a private owner of a resident versus in the common areas? So there's a lot of things that this law will need to be crafted to address those conflicting issues and then give clear guidance to the community.
Ty, I want to get back to some of your experience that you have right now as one of those certified medical dispensaries and being a part of this organization. What are some of the challenges that you find yourselves in right now? We know that there are some of those who have been licensed that are struggling right now just with the overall cost, demand, labor, many other issues that many businesses are facing. But as a whole, how would you describe the pulse of the industry as it pertains to those who have this current license?
Yeah, thank you for that. I think it is a bit of a misnomer that people believe that these licenses were stood up by, foreign or outside of state influences or big business coming in. We are all just small businesses. Many of us are actually family-owned businesses. And what it took to stand up each license was in excess of 10 million. $10 to $20 million are the average investments that you see from any of the medical licensees, because we are a vertical license, which requires us to grow, manufacture, as well as retail only what we grow and manufacture. And so to make sure that our shelves are stocked with enough product and variety of product that meets the patient's needs requires a huge back office and a huge support system. And so those are the things that have really made it difficult. I think when the state originally thought of the program, they thought the legislators thought we'd just be growing it outside or growing it in the beautiful Hawaiian sun and in the dirt. And of course, if you were to do that type of grow, we could have cannabis that is very, very inexpensive. It's a beautiful climate to grow cannabis, but instead we're forced to grow within an indoor environment in a highly secured building with video cameras that are recording every square inch of the cultivation facility. Background checks are required. Lab testing is required on every single product that is sold. these are the costs that build up because of the amount of regulation that's there and the amount of regulation that was set up to stand up this program. And I definitely understand why there was all these regulations, just so that we don't run afoul of any federal laws and we have federal intervention. So this was a requirement to really run this program, but hopefully, when we move forward, we can build upon the current program that already has this testing. The surveyors there's about 6 surveyors now with the Department of Health who solely focus on investigating and surveying cannabis properties. So there is a system in place, but we do support, of course, bringing other departments into regulating cannabis, just because the Department of Health is focused on different things. They're not focused on tax revenue. They're not worried about collections. They're more worried about patient safety, the public safety, product safety. But if you bring in representatives from tax, from agriculture, from consumer protection, these are different departments that have different lenses on how they can craft and help support a better program.
Ty, I want to stick with you. I'm interested to know this whole idea of having a dual use market where you would have recreational and medical, the kind of quality controls that you're describing. I'm sure many patients appreciate that, particularly people who are severely ill, maybe with cancer or other diseases that, they can't necessarily just buy something that's grown in a backyard or off the street. That's part of why those regulations were put in place. How do you see this going forward? Would you be able to have, a medical stream essentially and a recreational stream? Would the current medical licensees, open a separate wing of their business? Like, how would this actually work?
And you do see this in some other states who have different testing standards or requirements for the different type of customer. In the end, when you look at a medical patient and then a adult use patient, there's not much difference between them except for their current condition and likely how much they're using. With medical patients, we do advocate that there be no GET or taxes levied upon their medicine, just because prescription medicines don't have that tax currently. At this time, they do pay the GET on medical cannabis. On the adult use side, of course, we're looking at GET plus an excise tax anywhere between 5 and 15%, making it an effective tax rate of up to 19, let's say 20% on consumed cannabis. And that will make it, of course, much more expensive. I do believe at the end, though, that any cannabis that's put into someone's body, either through inhalation or through ingestion, should be lab tested and should meet high standards of quality testing. And that's just because, I think when I was young, I didn't really know about the different types of yeast and molds and toxins that can be built up in cannabis buds. Even though it looks perfectly fine, there could be something in there that could cause long-term damage if inhaled. And of course, with someone who's a medical patient, they have chronic conditions. Many of them will actually only ingest cannabis and not smoke cannabis. But on the adult use side, we don't want it so that we create all these other problems down the line with health just because we weren't being mindful and safe. And when it comes to stores themselves, in other states, they have set it up where there is a medical cashier or a medical area where there's different types of products at a different price point that are provided to medical patients, where the adult use cashiers will have a different set of products, mostly lower dosing and not as concentrated. And as well, there's sometimes different purchasing limits that are levied against an adult use patient as well as a medical patient.
Can I add on to that? So I've been to several of the dispensaries on 3 islands, and their facilities are well kept, well secure, and the testing and their relationship with Department of Health, ensures the highest quality, as well as they're able to bring, kind of measure the THC level. But one thing I did want to add is that this market, both legal and actually somewhat the medical use, is still that 1 in 5 buy it from a dispensary. That means 4 out of 5 purchase it through other, what we call gray or black market sources. And so, the concern will be is if there is a movement to legalizing, that since the product seems to be price elastic based on price and access, is that how do we make sure that these dispensaries are able to compete with their product versus the black market, which pays no taxes and no fees, right? And so that's the balancing act as we move forward. The state needs to look at is how do we do that? Because if not, then that market stays 1 out of 5 still buys it to their dispensaries and supports that process. But 4 out of 5 buy it from illegal or cartels or backyard grown. We still have the same problem in which that we'll have now 4 out of 5 products out there that's not tested, that could be laced or mixed with other products that has nothing to do with the dispensaries, but still enters our communities and our homes.
We're almost out of time here, but I want to just kind of end on a final thought. Ty, we'll start with you. There continues to be a lot of debate on this topic, and then we even see here in the comment section here with people chiming in saying that this is something that we should not support, that this is something that they should not allow. What is your final message maybe out there to those who are still skeptical about this proposal moving forward and this plan for a broader use of marijuana, both medically and by adults?
Yeah, I don't disagree that it can be a contentious issue, and different communities, because of their histories, have different viewpoints when it comes to cannabis. I think that to alleviate some fears, I do try to plead that there is a medical benefit to cannabis. I don't think there's an argument about that. There's been studies that have shown that it does help to alleviate symptoms. I also think that when you look at the adult use side, the harms that have been brought from alcohol and tobacco are much greater than what cannabis could bring, and that there is a healing component to this plant that many gloss over. A recent Star-Advertiser poll earlier this year said 58% of registered voters support cannabis. On a nationwide poll, about 70% of registered voters support legalized cannabis. And so I do urge people to look at the research to see, if a program is run properly, where we do have safeguards in place to protect children, to protect young adults, to protect addiction and people who would overconsume or take advantage of the program, then we have to make sure that there's safeguards in place to help those people, as well as enforcement that's there. And we'll work hand in hand with law enforcement to make sure that the illicit market doesn't continue to flourish, and that the lost revenue that the state could garner from taxes, and as well as the benefit of tested, safe cannabis for communities, be brought forward. So I would say that if you look at it from a harm reduction standpoint, there is no reason why cannabis should not be made legal for adult use.
And Yamane, we'll allow you to kind of have the final word here on this. And just to talk through, again, same question to wrap things up for those who may be, questioning still this issue, and those who may be not in favor of it. And then realistically moving forward into the next legislative session, what we can expect to see coming out from the legislature.
Sure. So again, thank you for this opportunity for us to speak. I do want to assure the community that the legislatives and the legislators I talk to, we're committed to making sure that moving forward, that we highlight the safety for our community and our keiki. So public health is a huge issue that will be incorporated as we move forward, as well as all elements, both tax collections, how it should be tested, how its impact on law enforcement, how will officers then have to deal with cases of DUI, because it's not just DUI with alcohol, it would be driving under the influence of another substance like marijuana. How is it going to impact our small and large businesses? These are issues that we need to address and put in a comprehensive bill if it's to move forward. I do know many of my member colleagues are committed to wanting to move forward on this, and so I would suspect that there will be a number of bills every year to try to move Hawaii towards that direction. But with the dual task force, the reason why we're committed to it is so that way we actually have the most accurate, up-to-date information, as well as learn from other states. So that way we don't make the same mistakes like California and other states that may have run into some significant problems, both in the county level as well as the state level. So moving forward, we're hoping to gather as much information, and those that are opposed or support, please, again, now that this information will be going out and you guys actually have a better understanding of the impacts and the fiscal issues that might come from this, to testify, talk to your area legislators, let them know your position.
Yeah, and on that, we did mention off the top that you're having the third of 5 meetings today. If people want to actually participate or just watch the stream of that, where should they go?
So there's a link on the Department of Health website for the dual task force which they can stream in and listen in. And again, these are recommendations that will be submitted to the legislature. So once a bill is introduced, then again, the actual setup that would go into law, that's where the specifics would be need to be addressed, right? So these are recommendations moving forward. Please chime in there, and you can also chime in during the next legislature, as well as working with the new administration coming in.
All right. Well, thank you both for joining us this morning. We appreciate all that you've shared. A very informative discussion. We encourage people, if you've missed any part of this, to go back and, of course, listen to the broadcast in its entirety, because there was a lot of information shared. But we thank you both for joining us here this morning. Aloha.
Aloha. Thank you.
Aloha. Thank you so much for having us.
Catch you guys later.
Very interesting, Ryan, to hear about this conversation. And, as Cheng did reference that Star-Advertiser poll earlier this year, he's right. A majority of people in Hawaii support some kind of legalization. But as we noted throughout the conversation, it's not as easy as just saying, okay, poof, it's legal. There is a lot of things that need to happen as part of that. It could even mean standing up a whole new department, taking it out of the hands of the Department of Health. Rep. Yamane saying that could cost up to $8 million to figure out how to regulate this, to make sure that there are quality controls and that, just the ripple effects of all the issues. And there is that disruption between the federal, as a Schedule I drug and what could happen here at the state level.
Yeah, and the conversation that will likely continue on with these meetings that are being held, these informational briefings, and moving into the next legislative session. We heard there from Representative Yamane saying that there is a lot of support for something like this to happen. And even if it doesn't pass this legislative session, we can continue to see these types of bills being introduced moving forward. Great to hear both perspectives on not only the process, but from Ty as well, about what he's currently seeing on the medical distribution side and the challenges that they also face as a business and industry here operating in Hawaii. On Wednesday, we will be switching gears and focusing on the rail.
Yeah, we always know that you guys have a lot of questions, and so we've invited Heart Board Chair Colleen Hanabusa to join us. Of course, since the last time she was on, the FTA did approve the amended rail route. So when could we see those dollars start flowing in? And what about the cracks in the concrete pillars that we're seeing in some areas and the safety tests that were just completed? We want to get her perspective on when we could actually ride the route and how the process is going when it comes down to the bottom line, the budget. So we'll ask her all of that right here 10:30 on Wednesday. Do join us then.
We'll see you then. Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.